Not everyone in America is getting a fair shake when it comes to healthcare. Everyone has heard the old drum that healthcare reimbursement system rewards treating sick patients, and as a result, there isn't a focus on preventative care. However, the new models that have been emerging over the last 20 years are incentivizing well care. For example, in 2024, the Centers for Medicare and Medicaid Services introduced billing codes that reimburse healthcare providers who engage community-based organizations to help patients overcome social and logistical barriers to preventative care, like arranging transportation, making appointment reminders, and guiding patients through follow-up care. My friend, Satya Sarma, has been in this space a long time and has some interesting thoughts on how payers, providers, and community-based organizations can work together. Hi, Satya.
Hi, Eric.
In the past, you and I have talked about the challenges of getting well care to everyone who needs it. And I think payers looking for innovative business models that lower healthcare costs while improving the quality of care would like to hear what you have to say. But first, can you give a little background about your experience?
Sure. Well, Eric, I've been a doctor for over 30 years. When I trained, it was very much still a sick care system. Then I went into practice in a retirement community, and I loved it. I saw my patients where they lived. I made house calls, nursing home calls, and when they were sick, I visited them in the hospital. I got invited to family Thanksgivings, and yes, I did get pies and cookies as payment at times. When I got interested in the power of preventive care, of managing people's wellness so they wouldn't get sick, I realized I'd have to understand the payer's perspective too. So I spent the last 15 years in health plans, and I've also worked in government agencies that oversee Medicaid. As a result, I've gained a well-rounded understanding of what healthcare looks like for people in the real world, as well as the challenges the policymakers face when they work to solve those problems.
Your journey has been very unique. Tell us more about this idea.
Well, what I see out there is a big disconnect. Policymakers incentivize preventive care. Health insurance companies want to provide it because an ounce of prevention truly is worth a pound of cure. But it's difficult to get that care to reach those undergoing personal challenges. How do you keep people well if they lose their homes or are worried about being able to pay the bills because of a job loss or divorce or debt? How do you reach the elderly who may be less mobile or those suffering chronic illnesses or despair? How can payers connect with people who may already distrust the healthcare systems? Payers have come to realize that helping with social challenges can help avoid expensive sick care. There are rules in Medicare and in some Medicaid states that allow health payers to cover social services in the community. So a grandmother with diabetes can avoid the hospital with a good diet, or someone losing their home can be housed so they're able to keep their insulin in a refrigerator. The hard part for health payers is connecting to those who need care in these circumstances. This is where community-based organizations come in. In every community, we have nonprofits offering services for those in need. They're rooted in their communities. They live where patients with these barriers live. They've built trust with the communities they serve. Payers can solve the challenge of keeping those with barriers to care out of the hospital by working not just with doctors and hospitals, but with community-based organizations to reach people who need these supports.
Yes, what a great idea. There are HCPCS billing codes for patient outreach services specifically created to address patients' health-related social needs, such as transportation to appointments, and to support patients in navigating high-risk conditions like cancer. Can you tell us more about this model?
Sure. Well, let me describe one that worked in our community relatively recently. During the COVID-19 public health emergency, We sent community-based health workers from community-based organizations out to people's homes with hand sanitizer, masks, and information about how to limit the spread. The community-based workers would take meals to people when they couldn't get to work because they were sick. They helped them access grant funds to pay their utilities, or helped them find free motel rooms through the county when they needed to isolate to prevent spread. The model partnered the community-based health workers with doctors' offices, so they could help patients get appointments with their doctor for treatment, or, if they chose, to get vaccinated. That same model can work now to reach those with chronic care needs. Payers can create partnerships between their provider, it is their hospitals and their doctors, and community-based organizations to get them care while they're still well, rather than let those social barriers delay care, deteriorate their health, and land them in an emergency room or hospital.
Thank you, Satya. Sounds like those community workers were able to build trust with people, which is key to getting people to participate in preventative care. I bet payers could see an ROI of 2 to 4 times their investment through reduced hospitalizations and lower emergency room use, if they created pathways for community-based organizations to work with providers.
Absolutely. The infrastructure, relationships, information systems, and training need to be put in place for this to happen. But the opportunity is there.
Thank you for sharing, Satya.
Thank you, Eric.